Welcome to the Person-Centered Care training provided by Cultural Homes, Inc. The goals for this training is by the end of the training, you will gain a better understanding of what is the meaning of person-centered care, understand what it means to deliver person-centered care, and learn how you can provide care that is person-centered. So what is person-centered care? Person-centered care is a philosophy that changes the focus of caregiving from accomplishing tasks to emphasizing on the person. As the result, the person preferences of residents become as important as providing the services and support that they need. Person-centered care requires a shift in an organization's values and beliefs from quality. Traditionally, high-quality clinical care is seen as the pinnacle of high-quality nursing home. With persons care-centered, high-quality clinical care remains critically important, but quality of care is valued as equally important, and we need to do both. So person-centered planning is the first step towards ensuring delivery of person-centered care support. Person-centered planning promotes the belief that people with intellectual and developmental disabilities are people first. They have valuable gifts and contributions to bring to the relationships with families and friends and the community as a whole. Person-centered planning views the entire person, not just the portion of the person that has identified needs. In simple terms, person-centered planning is an approach in forming life plans that are centered in the individuals for whom they are built. The individual is always at the center of the person-centered planning process. They are involved in the planning process as they want to be and are able to be. The planning process is best accomplished when it includes other people who also know the person well and believe in their vision. A group engagement process explores what the person considers to be most important in their current life, which is often shaped by the history and their plans for their personal future. This discovery process emphasizes on active listening with a focus on capacity, skill identification, and acquisition. The person-centered process is a combination between emphasizing on the person versus accomplishing tasks. We always put the persons first. So what does that look like? It means seeing beyond the illness or the disabilities of the person. Persons living with disability are usually more capable than we can imagine they are. And it means a combination between compassion, dignity, and care. The person-centered process helps to identify desired personal outcomes based on the individual's life goals, interests, strengths, abilities, desires, and preferences. The process helps to determine the supports and services that the individual needs to work towards to achieve their outcomes and to accordingly develop a plan that directs the provision of these supports. Person-centered planning gives people with intellectual and developmental disability the chance to talk about what is important to them and the personal outcomes they want to achieve in their lives. For people who have trouble speaking for themselves, others in their life who know them well and understand what is important to them use their voices to speak on the person's behalf. The planning process also helps people find out what potential problems may get in the way of reaching the outcomes and develop strategies to help address these things. The resulting plan helps people define their personal goals and highlight strategies that will enable them to pursue their goals and make them reality in their life. It is important to understand that people-centered planning will have results that go beyond the making of the plan. So what does it look like? It means working in partnership with your clients, asking your clients exactly what they want to do, respecting diversity, practicing ethically, challenging inequality, promoting recovery, identifying people's needs and strengths, making a difference, and promoting safety and positive risk-taking. It means asking the clients what they actually want instead of assuming what they want or assuming that what is good for them. Allowing clients to do what they wishes if it does not harm them. So what if they want a coffee at 5 o'clock in the evening when it means that they cannot sleep? If it does not harm them in any way, they have the right to do it. It also means involve the clients in as much planning and decision making as possible, allowing them to choose what they want to do. Next, we will watch a video and see some person-centered planning in action.
Scripps Gerontology Center is Miami University's